Well, good evening, everybody. My name is Susan Hay, and I'm the president of Environment Haliburton. This event is co-sponsored by Seniors for Climate Action Now, Climate Action Muskoka, Climate Action for Lifelong Learners, Below 2C, Climate Legacy, the United Jewish People's Order, and last but not least, Environment Haliburton. We all join together in welcoming you. We will begin with a land acknowledgement, and since there are people from all over Ontario joining us tonight, we honor all Indigenous peoples for their cultures, their languages, their wise teachings, their stewardship and protection of the lands and waters and life that have shaped this land. Together, we will take actions towards real truth and reconciliation, and we must strive towards wellness for all. We will walk together in respect, peace, and harmony for future generations. Tonight, we will be learning about the impacts that climate change has on human health. There will be a question and answer period following the presentation, and then Dr. Green has agreed to stay and chat for a few minutes with those folks who would like to stick around. You can type your questions into the chat as you think of them, and Terry Moore, who is Vice President of Environment Haliburton, will moderate our Q&A session. I would like to remind you to please only use the chat for questions of Dr. Green from this point on. Eric Willius, our Zoom wizard, has muted you so that you won't distract from the message. And we are recording this presentation and it will be available on our website in about a week. And now it is my pleasure to introduce my husband, Dr. Keith Hay, who is a member of Environment Haliburton and practiced family medicine for 30 years in Clinton, Ontario, and is currently a medical advisor for the College of Physicians and Surgeons of Ontario. And now Keith will introduce our speaker.
Thanks, Susan. Dr. Samantha Green is a family physician at St. Michael's Hospital in Toronto, and at Inner City Health Associates, an organization which provides a variety of health services for people experiencing homelessness. As well, Dr. Green is a board member with the Canadian Association of Physicians for the Environment and Faculty League on Climate Change and Health at the University of Toronto's Department of Family and Community Medicine. There is much, much more I could say about Dr. Green, but importantly, she advocates for climate action and social justice with the aim of improving the health of her patients and community. I want to extend Dr. Green a warm welcome and look forward to hearing more about the relationship between climate change and health.
Thank you so much, Keith, for the introduction, and thank you for having me. I feel a particularly deep connection, actually, to the Haliburton area.
I had already started this.
Having spent most of my summers at my parents' cottage, actually on Big Brother Lake, both as a child and now actually my whole family attends. We all go up to the cottage with my own kids. So when people ask me why I am driven to work on the climate emergency, I think both of my upbringing, which was centered around justice and equity, and also my time actually spent in the Algonquin Highlands. So thank you for having me. So before we dive in, I wanted to share, one of the other reasons I am so motivated to take action on the climate emergency. My two kids, who are currently in a bit of a bedtime chaos, neither of them are asleep yet, although both of them are normally asleep by now. So I'm also very grateful for my husband for taking care of things while I'm here with you all. And indeed, there's actually evidence that human compassion is most motivated by stories about children. And the 2019 Lancet Countdown on Health and Climate Change actually framed their report around the story of children born today. And they said, the life of every child born today will be profoundly affected by climate change. Without accelerated intervention, this new era will come to define the health of people at every stage of their lives. So most of you may have seen this before. These are the global climate stripes. I believe it's globalclimatestripe.com, or you can Google it. These stripes represent global average temperature from 1850 to 2019. And altogether, humans burned fossil fuels on a scale that has deposited 2,400 billion tons of carbon dioxide into the atmosphere over that time span. Interestingly, around 58% of that is from the dates 1850 to 1989, and the other 42% went in the atmosphere between 1989 and 2019. That is, in the 30 years since the world reached a consensus that climate change is a hazard, the greenhouse gas burden in the atmosphere nearly doubled. The latest IPCC report warns that emissions in the last 10 years were actually higher than in any previous decade. So this is just another illustration of that problem. We are currently at 1.2 degrees of warming, and the latest report from the IPCC says we will almost certainly hit 1.5 degrees of warming by 2050. And the report also says we must act now, immediately reduce emissions in order to avoid warming more than 1.5 degrees. And we know that every fraction of a degree above 1.5 degrees could translate into millions dead. And as the world warms, we also risk reaching tipping points where we could be stuck with irreversible warming incompatible with human life. Current trends indicate that without a much more determined worldwide response, temperatures will go on rising to at least 3.2 degrees by the end of the century. That is more than double what we all agreed on in the Paris Agreement in 2015. And these are the stripes for Canada. And actually, Canada is warming at twice the global rate. This is just another illustration of that from the IPCC report from last summer. And actually, the Arctic, including the Canadian Arctic, is warming at 5 times the global rate. So when we think of ourselves here in Canada, we often think, oh, we're a small country. How are we even contributing? And Canada is responsible for 1.6% of global emissions, which may sound small, but we are the number 9 global emitter. And we are among the top 3 emitters per capita at 21 tons per person per year. The global benchmark for a sustainable climate is 1.5 to 2 tons per person per year. And furthermore, Canada is one of the world's top fossil fuel producers. And the oil and gas that we extract and export does not even get counted in our own emissions and in our own emission reduction targets. So we actually have a disproportionate effect on global emissions. And we know from the latest IPCC report released, I guess, earlier this month, that global emissions must peak by 2025 and decrease by nearly half by 2030 in order to have even a small chance at 1.5 degrees. So Canada must begin to do its fair share in reducing emissions. And again, this is another way of illustrating this. This graph represents 5 possible scenarios for our future. Only the very low emission scenario actually limits warming to 1.5 degrees. Another reason I'm showing this graph is just that we do need to be aware that we are committed to further warming. I mean, like I said, we are at 1.2 degrees and we are committed to most likely 1.5 degrees and probably more. And here locally in Canada, we are actually committed to warming a further 1.8 to 2 degrees by 2040. You know, at that point, my children will be in their 20s. I also want to point out that we are currently actually tracking along the high emissions curve here, which projects 6.3 degrees of warming for Canada by 2080. And we don't know what this looks like, but we do know that it will or would be catastrophic. And at that point, my kids will just be hitting their 60s. And so ahead of last year's COP26 meetings, November 2021, more than 200 health journals came together to call for urgent climate action to keep average global temperature increases below 1.5 degrees, halt the destruction of nature, and protect health. And the British Medical Journal said it was the first time so many publications have come together to make the same statement, which reflects the severity of the situation. And that's because climate change is the biggest health threat of this century. And that was first stated in The Lancet in 2009 and reiterated by the WHO more recently. And when we think about how climate change affects health, there are a number of ways that we can think about it. So obviously, I think health is determined by more than just healthcare. This image was first published actually by the Canadian Medical Association in 2009. And at the time, it was a very big deal. This was a group of doctors acknowledging that only 25% of people's health is actually related to what we do as doctors. 50% is related to the social determinants of health and structural determinants of health as well. Just 15% is biology, genetics, and then 10% is the environment. This is a very powerful infographic, but I do think that it actually misrepresents the importance of the environment and planetary health. And this graphic, which was developed by my fellow board member, Dr. Courtney Howard at CAPE, I think better illustrates things. While yes, the environment is just 10% of someone's health, we need access to clean air, clean drinking water, and a stable planet before anything else can be addressed. It is fundamental. And unfortunately, I think the COVID-19 pandemic has really done a good job of illustrating this. We know, at this moment, there's no proven link between climate change and COVID-19. But what we do know is that further warming is leading to and will lead to habitat destruction and biodiversity loss, which leads to new proximities between humans and animals and other vectors of illness and disease, which will lead to further zoonotic spillover events and future pandemics. So certainly climate change is a driver for future pandemics. And we can think of the COVID-19 pandemic as a planetary health crisis, even if it's not directly linked with climate change. This is a very complex illustration from the Lancet Countdown 2019 on how climate change affects health. And I'm not going to go through it. It's just to illustrate that this is complex and there are many interrelated factors at play here. And this is a map taken from the Canadian report. So the Lancet Countdown is actually published every November ahead of the COP World Climate Meetings, which is an annual report on the state of health and climate change globally. And then there are specific country reports that are also published alongside that global report. So every year there's about a 2-page document that is published on the state of health and climate change here in Canada. And this is just a map from the 2019 Canadian report. It's available on the CMA website, illustrating the effects of climate change across the country. And so I'm just going to go through each of the effects fairly briefly. So most obviously, climate change results in more frequent heat waves, which particularly affect the elderly, small children, those who have chronic medical conditions, pregnant women. And extreme heat poses the direct threat of heat exhaustion and heat stroke, and then also worsens common diseases, including asthma, diabetes, kidney disease, and mental illness, with an overall increase in mortality seen, actually. And heat waves are also associated with increased violence, stress, and anxiety. Many common medications, including blood pressure pills, antidepressants, and allergy medications, affect the body's ability to regulate temperature and increases the risk of heat illness and dehydration. There are also certain populations who are more vulnerable to the heat because they are more exposed. So people who work outdoors, people who work in the gig economy, so who may not have a choice of whether to work or not on a particular day, thinking of like the Uber Eats drivers, and people who don't have access to air conditioning, people experiencing homelessness. We know BC's heat dome last summer, in just 5 days, in the latest analyses, more than 700 people died. There was an excess death rate of 700, and I think it was 86 people. And interestingly, and worryingly, people living with schizophrenia had 5 times the mortality of the average British Columbian, and that was likely a combination of the disease itself and also the impacts of the antipsychotic medications used to treat it. And I just think that's a good illustration of how climate events and heat in particular really target those who are most vulnerable. And of course, BC is not alone. Where I live in Toronto, extreme heat days are expected to more than double by 2040. And this was just a report published in the New York Times about a year ago of a study that modeled the risk of coinciding extreme heat and power failures. And actually, power failures have increased by more than 60% in the last 10 years, even as climate change has made heat waves worse. And that's likely actually attributable to the heat. So heat can affect infrastructure. And so using computer models to study 3 large US cities, the authors of the study estimated that if there was a combined heat wave and blackout, at least 2/3 of residents of these major cities would be at risk of heat exhaustion or heat stroke. So this is just something that we need to consider when we're planning for further warming. Climate change leads to an increase in wildfires, with an increased incidence in 3 out of 4 countries around the world in 2015 compared to a 2001 baseline. Wildfires cause direct physical injury and significant mental health effects, including anxiety and PTSD. And then, of course, poor air quality exacerbates asthma and other lung disease, can trigger heart attacks and strokes, can worsen diabetes control, and increases the risk of poor pregnancy outcomes like low birth weight. And you may remember the fires in northern Alberta. I mean, there were also forest fires, of course, last summer across northern Ontario and Western Canada, but this is just an example. So the fires in northern Alberta in 2017 led to the evacuation of the hospital in Fort McMurray, so including 880 patients needing to be evacuated, 19 healthcare facilities closed. And they also were able to document about a doubling in ER visits over the course of the fire season, and 4 times an increase in salbutamol prescriptions. So salbutamol is the rescue inhaler that's used for asthma and other lung disease. This I just included because I read it a couple of years ago when it was published, and I found it very powerful. If you recall, just prior to the pandemic, there was a very bad forest fire season in Australia. And this was a kind of memoir from a woman who experienced those fires. I don't know what I will do from here, whether having lived on the front lines of climate collapse will mean I choose to not get pregnant again. I know it has changed me. It has changed us all. Those who have seen the fires, lost homes, or breathed toxic air for weeks and months on end. It has turned an abstract fear into a concrete reality, shown us how climate change will alter even the most mundane aspects of our lives, from our morning rituals to whether we can leave our own homes. I think this just struck me as someone with small kids. And then similarly, this is a story from the California fires, same fire season actually, in late 2019. The healthcare system's early warning light is blinking red, the power grid goes dark, the smoke moves with the wind, our stethoscopes and scalpels won't suffice. When I took my solemn oath as a doctor, it wasn't to evacuate hospitals. We must refuse to let this be our new normal. So just move on, and don't worry, my litany of bad stuff is almost done. So of course, we know that climate change also results in an increase in tropical storms, cyclones, floods. These result in direct physical injury, mental health impacts, also lack of access to water and sanitation, and can lead to more waterborne diseases and diarrheal illnesses. And then also an interruption in access to healthcare services. I mean, we saw last fall the flooding across and the atmospheric rivers, a term that probably none of us had heard of before, with flooding across the BC interior and also in Newfoundland. And the town of Merritt, BC was completely isolated with all roads leading into the town destroyed. And so actually access to healthcare was a huge problem. And even just getting medications to people who were running out was very difficult. I've already touched a little bit on infectious diseases, but we know that the changing heat and weather patterns leads to a change in vector-borne disease. Now we see far more Lyme disease in Canada than ever before. I mean, I've diagnosed many cases of Lyme disease that people have contracted just in their backyards here in downtown Toronto. And globally, we know there's an increase in malaria, West Nile virus, dengue, and also Zika. Zika was linked with climate change. And this is just demonstrating the increase in transmission of dengue. I'll touch on this a little bit later, but we know, again, that climate change is a threat multiplier. Just like we've seen with COVID-19, people who are already marginalized are most affected. And so this is just an example of that. More than 400 people died in 2019 in one of the worst dengue epidemics ever recorded in Central America, and 40% of those deaths were in Honduras. And that dengue outbreak, basically there was no public health response because the public health system in Honduras has been completely gutted. It's a collapsed system full of pervasive corruption and basically no supplies, no staff. So that led to further death. With milder winters, we also see an extension of the allergy season and an increase in allergy-related illness. And last spring was actually, I don't know, you may have experienced it yourself, a particularly bad allergy season because of the very mild winter last winter. And personally, I saw an increase in visits to clinic, and we actually saw an increase, we measured an increase in overall inhaler prescriptions in our family health team in our clinic. And then finally, the largest two impacts of climate change are indirect. So the change in climate leads to displacement, which of course has a huge impact on mental and physical health, and also leads to disruption in access to healthcare and the necessities of life like clean water and sanitation. We know that climate change exacerbated drought and famine was one factor in the Syrian refugee crisis, and it's being called the world's first climate conflict. And drought and multiple hurricanes hitting Central America have contributed to the migrant crisis and political crises there. And migration is not limited to those in Syria or Honduras or Bangladesh. Climate displacement is already happening in North America, including in Canada. As I'm sure you'll remember, the town of Lytton, BC was completely destroyed by fire last summer, and residents there were forced to flee their homes, and you know, their community was completely destroyed. And then finally, drought and flooding has already led to decreased agricultural yields in 30 countries, and undernutrition is projected to be the #1 health impact of climate change globally. And this is from the latest Lancet Countdown 2021, just illustrating that land affected by drought has increased globally since 1950. And likewise, there's been a decrease in crop yield potential since the 1980s, in particular for soy and maize, and this is global. And we've seen this year even an increase in food prices here in Canada, and that's likely attributable to drought that hit our prairies and actually also hit Western Europe simultaneously. Of course, there are mental health impacts of climate change. I mean, I've talked a little bit about some of them from some of these climate events and climate impacts. And then of course, there's kind of probably what you're all feeling right now, having listened to all of that, stress and anxiety related to climate change itself, and possibly even some grief, some ecological grief about the state of the planet. I'm also just going to spend a second, maybe a minute, talking about air pollution. Of course, air pollution is not a cause of climate change, but the causes of air pollution are the same causes as for climate change. And air pollution has very significant impacts on health. So actually, I think this will lead to a bit of a good news story, because if we can tackle the climate emergency, then that will lead to a significant reduction in air pollution and a reduction in air pollution related disease. This study was published a year ago, February 2021, and found that in the year 2018, air pollution was responsible for 1 in 5 deaths worldwide. 1 in 5 deaths worldwide. And in addition to causing and exacerbating lung and heart disease, which probably is what you've thought about, air pollution has been linked with many kinds of illness, including cancers, various kinds of cancers, poor pregnancy outcomes, dementia, including Alzheimer's disease, diabetes, kidney disease, and mental health impacts. Kind of alluded to this already, but those whose health is most affected by climate change are those who are already most vulnerable and marginalized: Indigenous people, racialized people, people living in poverty, and others who are politically marginalized. And I'm personally already seeing this disproportionate burden in my primary care family medicine practice in downtown Toronto. This photo represents a patient of mine who has severe asthma. And he lives alone in a social housing complex, very tall building, concrete in St. Jamestown, which is the densest area in Canada. He has very sporadic contact with his adult children who live in the suburbs. He doesn't have, or didn't for a long time, have an air conditioner. Couldn't afford one. I did end up helping him to get one eventually, but I worried that his breathing would be affected on one of those extreme heat alert days, and he could die alone in his hot apartment and no one would know. And more generally, those with low income are less able to cope with rising food prices, are less likely to have insurance or money to rebuild or relocate after an extreme weather event. Those who are poor are less likely to have the resources required to build climate resilient infrastructure. And racialized and poor communities are also more likely to have aging water and sewage infrastructure and are therefore more prone to severe flooding. And often poor communities, and I see this in my own practice, have fewer trees and green space, which increases the risk from the heat. We see with the urban heat island effect, when there isn't enough green space, temperatures can actually be up to 5 degrees warmer than in other parts of the city. So that's my summary, climate and its impact on health. I'm gonna switch gears a little bit and hopefully talk a bit more about solutions now. So the Lancet, which called climate change the greatest health threat of this century, has also said that tackling climate change could be our biggest opportunity for health. First of all, tackling climate change will reduce illness associated with climate disasters themselves. And second, a decrease in air pollution will lead to immediate improvements in those illnesses that I mentioned, 1 in 5 deaths worldwide. And third, many of the solutions we need to tackle the climate emergency will have additional benefits to health. So for example, transportation causes 28% of Canada's greenhouse gas emissions. About half of that is from personal transportation. And we know that increasing active transportation, walking and biking, even taking public transit, is good for the climate, is good for air pollution, and also is directly linked with decreased mortality. So overall, less death, less heart disease, and improvements in diabetes. And this is just a screenshot of an academic paper that I published summarizing the link between cycling and improvements in health. Agriculture is responsible for 13% of greenhouse gas emissions globally. 30% of food produced globally is thrown away. And we know that a plant-rich diet actually has many health benefits. So note the language there. It's not plant-based, but plant-rich. So, we're not telling people that they can never eat meat again, but having mostly a plant-based diet is better for cardiovascular health. It's also decreases the risk of diabetes, can actually lead to improvements in mental health. And the Eat Lancet report actually summarized this very well a number of years ago. It was a full scientific review of what constitutes a healthy diet for both global planetary sustainability and for individual health. I didn't mention decreased risk of some cancers, decreased risk of Alzheimer's disease as well. And we're lucky here in Canada because actually, this is the graphic from the Lancet. And this is our new Canada Food Guide published in 2019, which looks very similar. And that's partially because this was actually the first public consultation of its kind that did not involve industry. And we at Cape were involved in the consultations that led to the publication of the new Canada Food Guide. So if you want to know how best to eat for both your health and the planet, you can look to the Canada Food Guide now. Urban green spaces, I've already mentioned, will decrease the urban heat island effect. Will also actually directly sink carbon into the plants, and then also improves well-being. Studies show that encouraging people to be outdoors improves mood and energy, improves self-esteem, increases a sense of well-being, improves sleep, decreases symptoms of depression and ADHD. And the evidence-based dose is 2 hours a week, minimum of 20 minutes at a time in a green space. So if we increase green spaces, especially in urban centers, we're going to improve health and tackle the climate crisis. And similarly, protecting nature will increase ecosystem services, will sink carbon into the earth, and gives us access to the benefits of nature. The WHO said in 2018 that meeting the targets of the Paris Climate Agreement would be expected to save over 1 million lives from air pollution alone by 2050. So that's another significant health gain that we will see. And to end this section off, the good news is that achieving a decarbonized global economy and securing the public health benefits that I've just mentioned is no longer primarily a technical or economic question, right? It's just a question of doing it. So that leads us to what can we do? And I think the COVID-19 pandemic has really shown how much we are capable of, how we are all willing to change the way we live to protect the health of our neighbors and communities, and how much we can actually transform our society when we really, need to and put our minds to it. And also money just appears, when we need to do something, money is just there. So I think that's also actually a hopeful story. So what can we do? This is a very bad infographic. I actually intended to try to create my own in time for this talk, but anyways, I didn't get around to it. But I like to think about what we can do at the micro, meso, and macro levels. And so I'll go into each of these in detail, but micro is basically what you can do yourself in your own life, in your own lives. Meso is what you can do kind of at the local community neighborhood level, and then macro is what you can do at the policy level. This is actually an academic publication from a family medicine journal about what we can do as family doctors to tackle social issues. So, I mean, it's a good model, but I don't know why it's an avocado. I don't think it really illustrates things. So, I mean, because of the scale of the problem, I do think that the number one thing we can do is demand that our politicians take action, because, we as individuals alone cannot solve the climate emergency. We need to address it as a collective, as a society. And as elections come up, say the provincial election, say the municipal election in the fall, we do need to demand that our elected officials and candidates treat climate change like the emergency that it is. So I'll get to some of the policy level advocacy that we can engage in a few minutes, but I'll just start with some of the more tangible personal things we can do. Individual actions are not enough, as I've said, to protect our global climate, but they are a great place to start. It can feel empowering to do something tangible. And when we take personal action and talk about it with family and friends, our actions can actually multiply and take on even more power. So this is from a report published actually by Diane Sachs when she was environmental commissioner. It's about the carbon footprint of the average Ontarian. And the average Ontarian personally causes about 11 tons of greenhouse gas emissions. And more than half, as you can see, are from these 4 activities: driving, heating our homes, flying, and eating beef. So if you think about taking action in your personal life, that's where you should probably think about making change. So driving less, switching to active transportation, switching away from a gas furnace towards probably an electric heat pump. There's some really great new technology. I now have a Zuba. I can chat more offline if you're interested. It's very exciting. Flying, so I mean, some flights are necessary, but really eliminating short haul flights. No one should fly from Toronto to Ottawa, and then really flying only when necessary. And eliminating beef. I mean, I'm not saying everyone needs to be vegan, but beef really has an outsized impact. Also at an individual level, I think the most powerful thing we can do is divest. So make sure your RRSPs and other investments are not funding fossil fuel development, and even consider taking your money out of the big banks and using a credit union. As you may know, RBC is the #3 funder of new fossil fuel infrastructure globally, like still, right now, they are still funding fossil fuel infrastructure, even though the IPCC says, as of today, no new fossil fuels. And none of the big banks are exempt from this. So probably the credit unions are the way to go. This is just illustrating the really outsized impact of beef, even compared to other meats and dairy products. Perfection is the enemy of the good. So I think it's important to make an effort in our personal lives to lead by example, to give oneself legitimacy, to spread the word to our friends, family, and neighbors. But we live in a system, and the system is designed around burning carbon. Or as Bill McKibben says, changing the system, not perfecting our own lives, is the point. Hypocrisy is the price of admission in this battle. So what can we do? I'll just move on at the meso level. So get involved in your local community, or what I found helpful is in my own professional capacity. So in your own professional capacity, or whatever you like to do, whatever your passion is. A number of years ago here in Toronto, I was part of, I co-founded a group called Doctors for Safe Cycling, which I think actually folds in both of those meso level actions. So we were advocating for bike lanes around Toronto, so very local level. And it was really leveraging my role as a physician. Yeah, and I think it was very successful. We kind of disbanded because we're no longer needed, especially with the pandemic. We now have many new kilometers of bike lanes in Toronto. And then also I'm working on sustainable healthcare, but I mean, I'm just giving this as an illustration. I think whatever career or profession or hobby that you're in, you can always work on climate action within that sphere. So in healthcare, healthcare is responsible for 4.6% of emissions in Canada, which is on par with aviation. So like quite significant. And if the global healthcare sector were a country, it would be the 5th largest emitter on the planet. So many of us are working on health systems change. We are organizing green teams, embedding sustainability into our strategic plans. That's what this is. This is my own family health team's new strategic plan with sustainable environment right here. And you know, the aim there is to get us to think about sustainability at all times. And the global leader in this is the NHS in the UK, which has a goal of net zero emissions by 2040 and an 80% reduction by 2028, which I find very impressive, and hopefully we can all follow their lead. So what can you do at the macro level? Before I jump into a few ideas for action, just spend a couple of minutes speaking about the importance of highlighting the health impacts of climate change and the health benefits of climate action, which I've just shared with you. This is from The Guardian in 2019, who decided that even in their images with their climate journalism, they will be using fewer polar bears and more people. This was a study of 342 US parents who were asked about their greatest concerns with environmental issues, and most were motivated by concerns about their children, which is unsurprising, rather than concerns about nature. So focusing on personal and family health impacts is more motivating to change behavior and also to induce public support for climate action. This was a much larger study, which tested the effects of different framings of climate change on, I believe it was 10,000 people in 5 countries, China, Germany, India, the UK, and the US. And the results of this study showed that using a positive frame, so talking about solutions and benefits, and using a health frame increases public support for climate action, even among those who are not really worried about climate change. So talk about health and also talk about solutions, and don't be all doom and gloom. This is just an interview from a couple of years ago from the CBC about how to frame climate change. And what he says is there are 5 S's to use and 5 D's to avoid. So, I mean, similarly, he says, use social, supportive, simple, story-based, so narrative language, and avoid doom, dissonance, denial, and identity. It's worth listening to anyways. And then finally, this is a study, oh no, not finally, almost finally, this is a study of how many? 1,000 Americans. Would you support climate solutions if they benefited any of the following? And as you can see, protecting personal and public health, 76% would support those climate actions. And then this is finally, this is climate communications scientist Edward Maybach, who says, simple, clear messages repeated often by a variety of trusted voices will affect change on the climate crisis. And I often show this slide to demonstrate that physicians, and in particular family physicians such as myself, are trusted voices, but also family and friends are second most trusted. So I think that means we all play a role in speaking out about climate change and climate action. So I'll just give a couple of examples of things that we've been doing at the macro level, and then hopefully there can be more in the discussion. At CAPE, we've successfully advocated in the past for, we were instrumental in getting the ban on coal-fired power plants, both in Alberta and Ontario. And, you know, that was a win for both climate change and for air pollution levels and health. We have actually seen a reduction in smog days from 53 in 2005 to none since the last coal-fired power plant shut down in 2014. And right now at CAPE, we are advocating against the export of thermal coal. So across Canada, there's a national deadline of 2030 for all the coal-fired power plants to shut down across the country. But we are still mining coal and exporting it to be burned elsewhere so that other people can inhale the toxic fumes. So we are advocating against that export. And we are also advocating against the fracking of natural gas. And we are providing some education around the health harms of natural gas, especially its use in cooking. As you may know, gas stoves are really bad for health. They can contribute to the development of asthma in kids and can also trigger asthma exacerbation. So if you can, switch off of gas cooking and switch to an induction stove, which are even better, even more easy to cook with. And if you want to learn more about that, the website, I believe, is unnaturalgas.ca. We're also advocating for divestment, and actually the Canadian Medical Association last year committed to completely divesting from fossil fuels. The OMA, which is the Ontario Medical Association, very conservative organization, much more conservative than the CMA, has actually also agreed to divest. And the CMA has also recently agreed to make sustainable healthcare one of its top 5 priorities for its next strategic plan, which is very exciting. Here in Ontario, we are also advocating for healthy urban planning, and we are fighting against urban sprawl. You know, the highway is just such a bad idea for so many reasons. I mean, it's a terrible idea in the climate emergency. It's bad because it'll increase air pollution. It's bad because it will cause induced demand, more suburban communities and more people dependent on cars. It's going to pave over wetlands. So bad for climate resilience. It's going to pave through farmland when we're in the midst of drought and decrease in agricultural yields. It's just a bad idea. And then finally, this is my second to last slide. At CAPE, we are taking part in the Ontario Climate Emergency Campaign, and actually our big launch and press conference is tomorrow morning at Queen's Park, and will be live streamed on our Facebook and Instagram. So you're welcome to follow along. And actually, I see Andre Forsyth is here in the audience, and he will be at our press conference. Thank you, Andre. We are now up to 150 member groups. So our groups consist of environmental groups, labor, health organizations, including the Canadian Federation of Medical Students, the Registered Nurses Association, of course, CAPE, a number of faith communities, a number of other community organizations, including we just had sign on from the Council of Canadians, which I was excited about, and businesses too. So if you are a member of a group, if you own a business, if you're a member of a faith community, please join us. There's this section here, group sign on. You can read our 12-point climate emergency action plan for Ontario. And if you agree with it, please do sign on. I mentioned 150 groups, but we actually represent now 500,000 members. So we asked each sign on to name how many, how big their reach was or how many members they had. And we're now up to a total of 500,000, which is very exciting. And so our aim is to get climate change on the agenda of the provincial election, and then I guess hopefully the municipal elections that will happen in the fall across Ontario. And then our aim is also to push the opposition parties to have stronger climate action plans and to really align their climate action plans with the science of keeping warming below 1.5 degrees. So to conclude, in the words of the director of the Department of Public Health and Environment at the WHO, our lives depend on a healthy planet. And finally, in the words of Nick Watts, who was at the Lancet Countdown and is currently the Chief Sustainability Officer at the NHS, he said, "We have a choice to drift into the greatest global health threat we've ever faced, or to embrace the greatest opportunity we've ever had to build a better world. The decision to act is entirely political." Thanks.
Okay. Thank you for that. Thank you for that, Samantha. There are a number of, we're kind of a little bit tight for time, and I just wanted to put that out there for a second, is that we had initially thought that maybe what we would do is call an end to the formal portion of this meeting about 9 o'clock and then do what we were calling an after chat. And I understand you're notwithstanding your kids rampaging tonight or being a little bit active, you're prepared to stick around for a while. And maybe another 20 minutes or so anyway after 9 o'clock for people who want to stay and have further conversations can do so. So I'm just going to start with a couple of questions, and then we'll see how that goes in relationship to the to 9 o'clock and the after chat idea. Sue McKenzie from Climate Action Muskoka raises something that you touched on with respect to pollution and so on, and coming from and close to transportation corridors, our transportation sector being responsible for a very significant proportion of our greenhouse gas emissions, but also the kinds of pollutants that cause asthma and really do undermine health on a variety of fronts. What she specifically is talking about the transportation corridors through Muskoka, and I think she wants to you to get your take on the threat that poses to residents and nearby residents, and whether or not there's anything specifically that you know about that's taken a look at the threat in the Muskoka area.
I'm not aware of anyone who's looked specifically at the Muskoka area, but actually very timely question. I'll just put in the chat. CAPE just released our traffic-related air pollution report, which I was a reviewer for, and we were also featured page 3 of the Globe and Mail. I believe it was on Friday. Basically, it summarizes the extremely vast literature that exists on the health harms of traffic-related air pollution. And if you read the report, I think it's like 500 pages. Don't read the report. It's just, I mean, actually, that's like the main message I took from it, was like how overwhelming the evidence is that it's like terrible for our health. And I think the hopeful message to that, or like the reverse, is what I've been talking about today, which is that if we tackle climate change, if we switch to electric vehicles, which is necessary in some areas such as Muskoka, if we increase access to public transportation, if we increase access to active transportation, then we're tackling 2 problems at once, climate change and this air pollution threat.
Okay, so just taking off from that last point that you made with regard to the connection to active transportation, Michael Black put a comment in the chat section dealing with the problem of active transportation advocates not talking about the toxic pollution that then people who are outside and are nearby, major traffic corridors and so on.
Yeah, it's a good point. It's a good question. So that is certainly an issue, but there have been studies looking at this, and overall, the benefits outweigh the risks. So the health benefits of engaging in regular active transportation far, far, far outweighs the risks of air pollution, because you may not realize it, but you're actually inhaling that same air pollution when you're in your car. So it's not like you're not really inhaling cleaner air when you're in your car. There are, of course, risks of injury, which are real, but which we can, build infrastructure against. So like if we have adequate, safe, protected, connected bike lanes in our urban and suburban centers, then we will protect people from those injuries. And actually, especially as we transform our society from gas-powered vehicles to electric vehicles, the threat of the air pollution will also decrease. But overall, there was a big study done, I believe it was mostly in Europe, but it was like a modeling study looking at the risks versus the benefits, and the benefits far, far, far outweighed the risk, I think like 11 times. Actually, that's summarized on our website for Doctors for Safe Cycling. I can put the website in the chat. Like I said, we're not active anymore, but we do have a page summarizing some of this research.
Okay, and so at the same time, Michael was saying, he asked the question, because of maybe the problems with respect to bike lanes and so on, that perhaps more emphasis should be put on building trails rather than bike lanes. But yeah, so what would your take be on that?
Yeah, I mean, we need both, but I don't think we should, I think we definitely need bike lanes, physically separated bike lanes, because people need to get where they're going. And usually that's the same places that cars are going, like, stores, banks, their doctor, work. And so they need to be driving on those major roadways. There's no question, but we need to build the infrastructure that protects them.
Okay, so there's someone by the name of Matthew Graveline has asked about whether or not you know about green health teams and or green. I'm not sure. Wait a second, I got the wrong one here. Anyway, I take it is that there's green time that's allowed. That is conversations between physicians and patients that talk about healthy living and I guess ways in which to protect yourself from the kinds of pollutants that that are involved in the changing climate. Do you think that kind of an opportunity to have those kinds of conversations between patients and physicians is an important thing to embrace?
Yeah, that's actually also very timely. It's not something that many people do, if anyone. There is a newish program called ParkRx, which my fellow board member, Dr. Melissa Lem from Vancouver, she's the medical director. So you can find their website, parkrx.ca, I believe. They're based out of BC, but spreading across the country. And it's the program is for doctors to prescribe nature to their patients, because as I mentioned in the presentation, there is an evidence-based dose of 2 hours a week, 20 minutes at a time. And then in BC, it's linked to a free park pass. And it now exists in the Maritime provinces, Quebec, I think in Alberta as well. So we hopefully can get it here in Ontario too. And then, I mean, of course, the major barrier is time, but it is, I think, something that we do need to be thinking more about, integrating this into, especially the counseling that we do around healthy lifestyles. And actually, in my family health team, we received a grant from the City of Toronto to engage with our patients on this topic. So we are putting on 3 webinars. The first will be on climate and health generally, but also specifically how to protect yourself during extreme heat, specific actions that people can take, and who's most at risk. Our second presentation will be about access to nature and the benefits of nature. And we're speaking to the neighborhood where we work. So we're gonna actually be providing specific resources about trails in the Don Valley, for example. And then our third one will be on plant-rich diets and the health benefits of a plant-rich diet. So it's certainly, people are thinking, doctors and health professionals are thinking more about this.
Yeah, I think we'll try to shoehorn one more question before we call a halt to the formal portion and go into that after chat, after people who need to leave or want to leave are able to do so. Moya Beal has put a question. It's actually quite a complex question, but it has to do with underfunding of the healthcare system, but also Ford's attempt to try to shift resources to privatized facilities. And that, she asked the question what the profession is doing to try to fight against that privatization. Could you talk a little bit about the relationship that you see between privatization, and the kinds of healthcare system that we really need to protect ourselves, under a climate emergency?
Sorry, can you repeat the question? Like protecting against privatization? I mean, I think most physicians in Canada would protect our public healthcare system with their bodies, and I think many of us are fighting against any move to privatize. But it's insidious and sneaky, especially some actions taken by certain political parties. So it's hard. I mean, I think there needs to be concerted advocacy around that. But sorry, the second part of your question, I didn't quite catch on the link with climate change.
Well, I think that there's a reference that Moya made to a couple of things that Ford has done. For example, underfinancing the public health system, which became really obvious during the COVID-19, that our capacity to respond to that particular emergency was undercut. But also, I mean, we're asking public health units to take on more responsibilities to deal with things like, heat dome problems and the kinds of things that are going to get exacerbated, by climate change, all sorts of increased, disease possibilities and so on. I guess, do you see the relationship between the underfunding of the healthcare system, and the need to organize within the medical community to fight back, to try to make sure that the resources that are spent on the healthcare system are restored in Ontario? I think we're one of the lowest per capita expenditures in the country.
Yeah, I mean, I think it just illustrates the gutting of all kind of collective action in public services. And as I said, like, this is a problem we need to address as a collective, as a society, which means we need like very strong and interventionist actions by the government, like far and away more than what Ford is doing or would ever do. Like, I don't know how many of you have read A Good War by Seth Klein, but in it, for example, he calls for new government institutions to, arm's length crown corporations, even at the provincial level, to, for example, run heat pump factories, because that's the level of transformation that we need in our society. We can't rely on the private sector to build heat pumps. We need to be doing it as a collective. And it's also going to address the issue of just transition for fossil fuel workers. We also need a very robust public education plan on climate change, because as you know, the vast majority of the public has no idea. They don't know the level of emergency that we're in. They don't know the health impacts of climate change or don't recognize it broadly. And so we need a public education campaign on that from the government. That's what we need, like we had with COVID-19. So far, I don't think Ford has shown himself capable of doing any of that.
Okay. So I think what I'll do is just pause there for a second. I'm going to throw things back to Susan Hay to say a few words for people who want and have to leave. And then anybody who wants to stick around, Samantha's going to be around for another 20 minutes or so while we, for what we're calling after chat. So Susan, do you want to say a few words before we go to the after chat?
Sure will. So I just like to thank Dr. Green very much for your very informative and thorough presentation. And I also like to thank you for the important work that you do for CAPE. And I'd also like to thank Eric for managing the Zoom controls, and to Terry for moderating the Q&A, and to our viewers for participating in our event tonight. And as we mentioned, Dr. Green has offered to stay for a few minutes to chat. And so anyone who would like to is welcome. And thanks again, everybody, and good night.
So I think we're just going to head right back into any kind of questions people want to put in chat. There was a comment that was made with respect to, and you mentioned it in your presentation about the balancing of bad news and good news. That is, talking to people about the realities of the climate emergency that we face. And that is treated as being largely doom and gloom, because the numbers are scary. The direction things are heading in can cause a lot of people to run away from the conversations. Can you say something about your experience in terms of balancing the science, the numbers, the talking about just how much the emissions are out of control and how fast we have to reduce them, versus the kinds of how does that play in terms of the engagement work that you do, and the balance between positive and negative messages?
Yeah, that's so tricky. I don't think it's easy, and I don't think I or my colleagues always find the right balance. I think I tried to model it with today's presentation, although maybe I spent a bit too much time on the issue, on the problem. But I think we need to tell the truth. That's also from Seth Klein, tell the truth. And talk about those IPCC reports, which are consensus from all the world governments. So it's not controversial. This is what's happening, and we have to all be aware of that. And we have to let everyone know that that is what is happening, and that's the reality. And then we have to switch like very quickly to talking about the solutions, and that we have the solutions. We actually have all the solutions. We just need to do it. And this is how we can do it. And this is what you can do to help us do it. That's the tack I try to take. And adding the narrative, and adding the benefits of taking action. And I mean, I think I didn't even touch on all the benefits of taking action because I was really focused in on health benefits. But of course, there are a myriad of other benefits because our society as it is now is not perfect. And by making this bold transformation, I mean, there's a lot of potential to actually improve people's lives in many other ways. One of the things that I've heard called for in creating a very just, a robust, just transition is a triumvirate of policies, which to me sound idyllic, which would be guaranteed basic income, federal jobs guarantee, and guaranteed basic services. So if the federal government were able to implement that, like a universal basic income, a federal jobs guarantee, and universal basic services. And I mean, we'd have to define what that is, but like access to healthcare, access to daycare, access to education. Like that sounds like a pretty good society that I'd want to live in. And it would also very much support the transition away from a fossil fuel-based economy.
So you see paying attention to those equity issues as being absolutely essential in building the kind of movement that would be necessary to push governments to do the kind of aggressive action that you're talking about at the scale of the climate emergency. There is a question that Sarah Chartel put in chat about women's health in particular. I know you touched on some pregnancy-related, particular vulnerabilities, but are there other things that you didn't have a chance to mention with respect that are particular to women in the climate emergency that you wanted to add to that?
Thank you. Yeah. I have to be honest, it's not something I've spent a lot of time thinking about, but I know that there is work out there and people working in this field who have documented like the disproportionate impact of climate change on women. Yeah, I don't think I actually feel like I'm not the right person to answer that question, though. Actually, it makes me think I should do some more reading about it. I actually do work. So my work with Inner City Health Associates is at a women's shelter, which I really enjoy and appreciate. It's very fulfilling. And that is an area where I have had some thought like around homelessness and the risks of homelessness and the climate emergency. I mean, of course, there's the obvious risk of exposure. There's also migration and an increase in migration, I mean, globally, but also here in Canada, and how that will lead to an increase in homelessness. And there are other risks, even thinking back to last summer here in Toronto and the encampments, and then the crazy political response of destroying the encampments where people were just trying to be safe away from COVID. And I'm sure we'll see more of that with climate related disasters. But anyways, sorry, I don't have a good answer to your question.
Okay, so you have had some experience dealing with and talking to and lobbying governments. And one question that's in chat has to do with, the difficulty of understanding the gulf between the science on the one hand and the level of ambition that the science calls out for in terms of recognizing that we're in an emergency and we need to respond at that scale, and the kind of puny response of governments like the Ford government, for example. And how do you make up? How do you think we can get ourselves organized enough to get the government to pay attention to the science, to bridge that gap, and to actually get some real action taking place, as opposed to sort of just them paying lip service to the problem?
Yeah, isn't that the $1 million question, though? Like, how do we do that? Like, let's all talk about that. I don't think I'm the one to answer that question. I mean, what we're trying to do with the Ontario Climate Emergency Campaign is bring multiple stakeholders together from across the province, from many, many, many sectors, hopefully more, and growing just to show, I mean, not only to the Ford government, because we know they're probably not listening, but to all political actors that like this is an emergency, and like our 12-point plan really is clear that this is an emergency and we need to act like it's an emergency, you know, calling for an investment, for example, of 2% of Ontario's GDP, and, you know, calling for action that aligns with the science. Anyways, so the goal is, yeah, really to speak as a collective that this is an emergency, but I don't know, like how, like even just thinking of the Trudeau government and like, you know, declaring a climate emergency one day and then buying a pipeline literally the next day. And then even more recently, you probably all know, the IPCC report part 3 was released, which said we need to peak emissions by 2025, have emissions by 2030. And then like the very next day or 48 hours later, Trudeau approved a big oil and gas rig off Newfoundland. So I don't know. I wish I knew.
Well, I guess what we can agree on is that probably we need to build the biggest and most powerful climate movement that we can imagine in order to basically hold whatever government survives after June the 2nd, you know, accountable for taking some real serious action. Okay, I don't see a whole bunch of action in chat. I see a lot of comments about, you know, thank you for the presentation and so on and so forth, and wanting to know more about where this is going to be available. And it is going to be, we have a resource list that we're going to be sending out to all registrants after tonight's meeting. And as we mentioned, the recording of tonight's presentation will be available in about a week, and we will send notification of that to everybody who was registered for tonight, along with the link to how you can actually access it. So I'm just taking a look to see whether there's anything in chat that we, I mean, there's a lot of stuff about collective action and so on, and trying to encourage people to do more of the kind of talking that we've been doing tonight, and then to get together to figure out how we can build that climate movement that's capable of being able to hold governments accountable. But the emergency program that you're involved with, you know, the Ontario Climate Emergency Campaign is one thing. SCAN, the Seniors for Climate Action, is part of that. I just want to take a minute to say that SCAN is sponsoring an event next Tuesday night. SCAN has done a lot of work around Ford's climate, you know, lack of a climate plan and his climate crimes, we're calling them. And so we're holding a meeting on a similar meeting to this on next Tuesday night at 7:30, called Doug Ford's Climate Crimes, a SCAN indictment on 34 counts. So the Seniors for Climate Action has spent a good deal of time investigating all sorts of things that the Ford government has been doing that's related to the climate emergency. So we're inviting people to come together to have a conversation about that. That's Tuesday, May the 3rd at 7:30 p.m. And you can go to the Environment Haliburton website if you want to register for that event. Let's just see if there's anything. So someone is asking what your thoughts are on the incineration of waste proposals. Is CAPE engaged in any of the discussion about a circular economy?
Yeah, quite a bit in the kind of sustainable healthcare work, which actually CAPE isn't doing much of, because actually many other organizations are involved in it, including the CMA, Canadian Medical Association. So in the sustainable healthcare realm, there's definitely talk about circular economy. Incineration of waste in particular, I mean, it's very complicated. I don't know very much about it. I know that for some waste, like for medical disposal, it's actually the most sustainable way of disposing of the waste. Just thinking about like medications, for example, it actually like eliminates the toxins. But so anyways, but it's a very complex issue, and I don't know that much about it, so I don't think I can comment further. But yes, around circular economy, and also another area of focus that CAPE will be taking on in future is around well-being economy. So really advocating against the use of GDP as a sole measure of, you know, how good our country is doing, and really looking at more of well-being economy indicators, really pushing for that.
Okay. Just checking again in the chat box to see if there's anything that's actually popped up just now. Okay, there's just a number of people saying that, reiterating the notion that joining one of the groups that's the co-sponsor of tonight's event is a really good way to engage in collective action to try to get to the point where we can hold governments of whatever stripe accountable, to acting and putting plans in place that are, coincident with the science. So I think we're going to leave it there. I think.
Terry,
I want to thank you for taking the time to be with us tonight, Samantha. It was very helpful and very interesting, and I hope it's opened a number of doors for people to think about the connection between human health and the climate emergency. So back to you, Susan.
Thanks for having me.
Oh yes, thanks very much, Samantha. There was a question from Nell Thomas just at the very end. I'm not sure if she's still on, but
I didn't see it. I didn't see it.
It's right at the very end. A question about patience, she said, but
but she didn't put it in chat. She just raised her hand. So we can't unmute anybody right now. So I think that if the question had been put in chat, we could have asked Samantha to comment on it.
I can unmute her.
Oh, okay.
Or we could just finish.
Maybe she could communicate directly with you.
Yeah, let's do it that way.
Probably.
Let's encourage Nell to get together with Samantha to have a conversation between doctors.
Yeah, she says okay.
Okay. Okay, so Susan, over to you.
Well, I'm just going to say once more, thank you so much, Dr. Green, and I hope you have a pleasant and relaxing rest of your evening.
Take
Good
care.
night, everyone.
Thank you, Samantha.